Hi guys, Coach Flores made it official. Tua has a rib fracture. As I've said in my first and second video, rib fractures can take time to show up on x-rays. So what probably happened is they did the x-ray, that was negative, they did the MRI to check to see was his spleen okay, was there any other soft tissue injury, and then that was all normal, then they probably did the CT to determine that he actually does have a rib fracture. Rib fractures increase your risk of developing pneumonia because you're going to have a hard time taking deep breaths in and deep breaths out. So Tua's going to be on a regimen to make sure that he's not going to get pneumonia. So two range of motions that get limited with fractures of the ribs in this area are 1, rotation of the spine, and then 2nd, movement of the arm and the shoulder. So the good news here is that when these ribs heal, that range of motion comes back. And that's why the team's going to ensure that he gets all the therapy that he needs. Because a quarterback needs those two ranges of motions. I'm Dr. Puja. For more sport stuff like this, like and subscribe. Hi guys, Dr. Puja here. Ian Rappaport is reporting that Tua had bruised ribs, and further testing did not show additional cartilage damage. He's TBD for Sunday. Bruised ribs happen because the blood vessels that line the ribs have ruptured. They've ruptured from some kind of injury, and in Tua's case, it was that impact that caused him to have a bruised rib. So this injury causes a lot of soft tissue swelling. Basically what that means is there's a lot of fluid in that area, there are a lot of inflammatory cells, there's a lot of edema, and all of this is occurring to actually heal up the injury. And this pressure of all of these inflammatory cells and edema actually puts pressure on that nerve, and that's what causes the pain. In a rib injury, it's good to not have any cartilage damage because cartilage damage takes a very long time to heal. Part of the treatment protocol for a bruised rib could be an incentive spirometer. So that's a very cool little device. You kind of blow into it, out of it. The purpose there is it allows your lungs to stay expanded so they're working at their full capacity. So in addition to the incentive spirometer, Tua is going to be resting, icing it, and maybe taking any NSAIDs to decrease the inflammation there. And that's about it, simple enough. Hey guys, so NBC is telling us that Tua's x-ray was negative for a fracture. I'm Dr. Puja, and I'm going to tell you a little bit about his injury. What you need to know is that rib injuries hurt, and rib fractures hurt even more. So the reason it hurts is because we have intercostal nerves. When something fractures there, when you have a rib fracture or a rib strain, those nerves get irritated and inflamed. I want you to know that even though his x-ray was negative, that does not mean that he doesn't have a rib fracture. They do an x-ray real quick to make sure that his lung was not punctured, which is called a pneumothorax, and that can be deadly. Tua's doctors are going to follow him very closely to make sure that he's not getting pneumonia. And the reason they can get pneumonia is, do you remember I talked about the pain in the ribs? Well, that pain in the ribs prevents a person from taking a deep breath in, so they're taking shallow breaths because of the pain, and then that increases the risk of getting pneumonia. So I don't think he's going to come back to the game because it could very well be a hairline fracture. He's going to be out for about a week or so because there's going to be a lot of pain there. And as a quarterback, he needs all of that thoracic movement. Oh, and before you go, remember, it can take 2 weeks for that hairline fracture to show up. So we're going to be on the lookout for it.